for other professionals or organizations to understand what's happened to you. So, for example, outpatient rehabilitation centers like the CRC or Mentor can use a report to determine whether or not somebody's appropriate for their program. They can look at that report, they can say, okay, this is somebody that we can work with, they're perfect for this program, and they already have a head start on where they want to go in terms of their treatment. Working with Department of Social Services for Disability. CSS wants to know information about the individual's abilities and disabilities, and the report can be used to help in the determination of your eligibility for benefits. So they're going to determine, based on the report and other factors that they have, how disabled you are and whether or not you're eligible for disability. Workers' compensation. Many people are injured on the job, and there are frequently questions about whether this individual is able to go back. So the question is, are they disabled? Can they return to work? Or what accommodations may be required for this individual as they come back in? And finally, legal issues. So many individuals who have sustained an injury have acquired their injuries as a result of an accident, whether it's a car accident or an accident on the job. And again, the assessment provides objective data on the individual's brain function, how the injury has affected them, and whether or not there's been a change from somebody's pre-injury baseline. So there may also be a specialized forensic eval in which a report's requested by an attorney to document that an injury has occurred, quantify the extent of the injury, and describe how it's affected. Just want to sort of put an advisor here. There is also a distinction between an assessment for clinical care and a forensic assessment that an attorney may request. And in this case, the referral, in the case of a forensic thing, it should really come from the attorney, because it's not going to be covered by insurance specifically, so it's coming for that for different purposes. And the procedures and the way that it's actually handled may in fact be different, or will in fact be different in the case. All right, so at this point we've talked about reasons for the assessment, but for those of you who have not had an assessment, I want to spend some time talking about what to expect. So first of all, time. How long is an appointment? What's it going to be like? That's going to depend a large part on the referral question. Why are you coming in and what are your objectives? In some cases, there may be a specific question that needs to be answered. So it may be a focused assessment or a relatively short eval. If we're talking about return to work for a very high-level job, then it may take many hours. And also, there are individual differences depending on the person, their ability to participate, level of fatigue, age, other individual factors, which will all affect the length of the assessment. Just to give you sort of an idea, my typical outpatient job usually starts at about 9 o'clock, and we go to about 2 or 3 o'clock with a break for lunch. So it does take a couple hours to get through the assessment. Some of them are even longer than that. So it can range from a couple of hours to even over multiple days. So before coming to the appointment, what do you need to do? Many psychologists will send out a history form, and it should really be completed prior to your appointment and sent in. Now, we request this because the information in the history is used for planning the assessment. It helps the psychologist to make the most efficient use of your time together and really know what to expect. So I'll pick certain tests based on what it is that you need and sort of help me design the assessment. Plus, there's going to be a lot of information in that history, and it helps people to organize their thoughts before they come in. You at least know what the questions are, so you don't have to reach and search on the moment, and it can really help both of us to sort of get through a lot of information in a short period of time. In addition, if you ever had a previous neuropsychological assessment, it's really important that you tell the psychologist and get that to them in advance. And the reason for that is a couple of things. One, I really want to get a sense of what those scores were like, but I may again alter the battery. Depending on what tests you've seen, I may want to repeat specific tests again. Okay, well, this is how you were doing then, how are you doing now? So we can get an actual direct comparison on a very specific test. Another reason is I might want to avoid someone. Sometimes exposure to a test, there'll be a practice effect. You've done it once, you'll be better now, so I want to avoid that. You've already seen that one, let's try something else. Okay, so, the night before. emphasize this enough. Do not try to study. People will try to study. They will look things up, or they'll think about what their objectives are, or what their question is, and they'll start researching and studying up. You can't study for the assessment. Okay. So really, it's not a pass-fail exam. It's really to look at your optimal ability. How are you doing on different kinds of things? And there's no idea you could really anticipate what to expect. It's supposed to be a new experience. That's part of the assessment. They should be things that you haven't seen. If you've seen them before in detail, you would do better than and I wouldn't get a valid measure of how you were doing. So more important than studying is to try to get a good night's sleep. You want to be well rested. You want to be able to come in. If you're too tired when you come in for the eval, you're not going to be able to give your best effort, and that's going to affect the validity of the assessment. You're not going to really get a good picture of how you're doing. So on the day of the appointment, you should be comfortable. You're going to be here a while. Don't get dressed up. Be comfortable. Come in. Be ready to sit down and work on something for a while. You're going to need to bring reading glasses or hearing aids, anything that you would need to help you interact with the examiner. Normally, we'll start off the day with an interview. I want to discuss your current situations, look at the questions that you have. We're going to review the questionnaires, look at your cognitive complaints, look at your medical history, medications that you're on, your academic history, and you'll get a lot of information. Now again, you're working with a psychologist. This may be personal. We may ask personal questions. So you should be prepared for that. You're going to need to know a little bit about your psychological history, so things like that will come up. Another point is that it's really helpful sometimes to bring a family member. So, for many reasons. For one example, I get patients come in all the time. Doc, I'm fine. There's nothing wrong with me. I'm ready to go. I don't even know why they're sending me. Meanwhile, looking at their spouse who's sitting right there, rolling their eyes because there's been some big change, and they're just not noticing it themselves. So I need that collateral information. I need to know what else is going on, so we can really get a good sense of what's happening. In addition, in the case of an injury, a lot of people have amnesia for the injury itself. So they may not know some of the details around it. And many people have been in a coma for months, and they need large pieces of information about their history that they don't know. So to have somebody else come in and really help me pull apart what's going on, what is the history in an efficient manner, really helpful to have another come in. Or at least talk on the phone. If somebody can't come in, you can always call afterwards and get some more information. All right, so we're done with the interview. What is the assessment like? What are you going to experience? We're going to be working one-on-one with a psychologist or sometimes a technician. Many tasks are going to start off easy, and they'll get progressively harder. Some things will be difficult. Again, this is to assess your maximum ability on various tasks. If we get to something you can't do, it's okay. That's the design. That's why we're doing this. We're really looking at your maximum ability. There are going to be things that you can't do, and don't worry about that. Very frustrating for some people. The examiner will not tell you the answers. They may not tell you how you're doing during the evaluation. When you work with your therapist, they'll work with you and go, oh, look, well, you made this mistake.